I see some people are still joining, but I think we are ready to start. It's very nice to see all of you today. My name is Maddalena Bianchi. I'm a policy officer at OII Europe, and we are co-organizing this event today with the Office of the UN Human Rights Office in Europe. I think I will give the floor to Dan for a brief welcome, and then I will introduce the speakers.
Thank you, Maddalena. Dear all, good morning. Thanks for being with us today. For this webinar on the occasion of the presentation of the report of the Office of the United Nations High Commissioner for Human Rights on discriminatory laws and policies, acts of violence and harmful practices against intersex persons. I will give a very short introduction and then I'll give the floor back to Maddalena to introduce the speakers. On April 2024, the UN Human Rights Council adopted its first ever resolution on the rights of intersex persons, calling on member states to enhance efforts to combat discrimination, violence and harmful practices against intersex persons. This resolution called for the preparation of a report by the Office of the United Nations High Commissioner for Human Rights, examining in detail discriminatory laws and policies, acts of violence, and harmful practices against persons with variations of sex characteristics in all regions of the world, their root causes as well as best practice to safeguard the human rights of intersex people. This report, called Report on Discriminatory Laws and Policies, Act of Violence and Harmful Practices Against Intersex Persons, was officially launched on the 15th of September 2025 during a landmark panel discussion that took place at the 60th United Nations Human Rights Council, and it was its first of its kind. Given the importance of the report, the UN High Commissioner for Human Rights, Regional Office for Europe and OII Europe decided to organize this webinar to introduce stakeholders to the report, while at the same time providing an opportunity to discuss the state of intersex rights and the situation of intersex people in the European region. We're very happy to be a part of this pivotal moment for the intersex community all around the world. I will give now the floor back to you, Maddalena, to introduce the speakers, and because of an unexpected shortage of human resources on our side, you will hear me again as one of them. Thank you.
Thank you, Dan. So we will have 3 speakers today for our webinar. Instead of 4, unfortunately, the European Commission could not join us today. So our first speaker will be Michael van Gelderen from the Office of the UN High Commissioner for Human Rights. And he will give us an overview of the recently launched report on intersex person. Michael is a human rights officer with the Women's Human Rights and Gender section. He leads the team working on human rights, gender identity, gender expression, sex characteristics, and sexual orientation. He's based in Geneva, Switzerland. Our second speaker will be Miltos Pavlou from the European Fundamental Rights Agency, and he will present the main findings from the latest FRA report on intersex person in the EU. Miltos is a project manager with the Equality, Inclusion and Sustainability Unit at the European Fundamental Rights Agency. And finally, our third speaker will be Dan Christian Gattas, Executive Director of OII Europe, who will give us an overview of intersex rights in the European region. OII Europe is the umbrella organization of European human rights-based and intersex-led organizations. We work for the protection of intersex persons' human rights in Europe, Central Asia, and the Maghreb region. And following the 3 presentations, we will have a Q&A session where we invite you to engage in a conversation with us and ask questions to our speakers. There is a Q&A section in the webinar, so you can ask your questions there. Or you can also raise your hand and put on your camera and ask your question. So now I'll give the floor to Michael for the presentation of the report.
Thank you very much, Maddalena, and hi, everyone. And then, Ricarda, I understand you will put the presentation up. Thank you so much. Great. So can everyone see the presentation? Perfect. All right. So thanks so much again, and really thrilled to be here. As Dan already mentioned, the report was produced following the resolution adopted last year in April, and it was presented earlier in September. It's the first mandated report on the rights of intersex persons. So yeah, it's a really important milestone event, and also want to thank all of those who contributed to the report. We received 190 submissions, but especially from intersex organizations, including OII Europe, but many intersex organizations throughout Europe as well, and of course from states in the European region, and from national human rights institutions, from other stakeholders as well. So I'm going to go over briefly the key report findings, and then if there are any questions, obviously happy to go into them during the Q&A. So the first section of the report really is a fairly short section, but focuses on the relevant international human rights norms and standards. And maybe the key points to highlight there is really the emphasis on the consensus around the concerns around human rights violations faced by intersex persons throughout the world that have come from a range of mechanisms. So UN treaty bodies, like the Committee on the Rights of the Child, the Human Rights Committee, Committee on Economic, Social, and Cultural Rights, Committee Against Torture, Committee on the Rights of the Child, CEDAW, the Committee on the Elimination of Discrimination Against Women, many special procedures mandate holders, of course, the UN Human Rights Office, OHCHR, but also the World Health Organizations and regional mechanisms. So, of course, in Europe, the Council of Europe, and its different mechanisms and institutions, but also the African Commission on Human and People's Rights and Inter-American Commission on Human Rights. So strong consensus around the concerns around human rights violations faced by intersex persons and the need for states to address these. And then it highlights a little bit the range of rights that are affected, range of rights to life, security of the person, freedom from torture and ill treatment, non-discrimination, equality before the law and recognition before the law, health, education, employment, bodily autonomy, physical and psychological integrity, participation in recreational activities, sports and cultural life, and access to justice and remedy. And then also in relation to specific rights of the child, again, life, health, but also preservation of a child's identity, and the right to be heard and their best interests to be taken into account in all actions that concern them. So that's an overview of the international human rights norms and standards. Then the report goes into a chapter on human rights violations, and I'm going to highlight some of the main sections. So the first section is around violence and also infanticide faced by children, and there some highlights really are that the data shows high levels of hate-motivated violence, including physical and sexual attacks. And of course, we have surveys from the European Union side, fundamental rights agencies, and I'm sure we'll hear more from Miltos, but also from other regions like Latin America and the Caribbean, but also qualitative data from other regions. And we also have, and I think this is important to also highlight, surveys of intersex civil society organizations showing violence against leaders of intersex organizations, vandalism of offices and events, but also threats against the intersex community made, for example, online and against organizations. One of the key sections in the section on human rights violations is around medically unnecessary interventions without consent. And the report highlights that these are forms of violence and harmful practices, and that they violate rights to physical and mental integrity, and freedom from torture and ill treatment, and of course the right to health. The report emphasizes the long-standing reports by intersex organizations and others, emphasizing lifelong pain and negative consequences on the physical and psychological health of intersex persons of these practices. And also that these practices are very often driven by parental and or doctors' preferences or discomfort around appearance or societal expectations about how bodies function. And one key highlight of this section is also the World Health Organization review in 2024 of medical literature around such interventions, and emphasizing, the review emphasizes that 40% of studies emphasize appearance of intersex babies and children as a rationale for carrying out these interventions. 60% provide no rationale at all for the timing of these interventions, i.e. why carry them out so early on babies who are not able to, or infants who are not able to provide, engage or be consulted or provide consent. And 40% provide no rationale at all for the conduct of these interventions. The World Health Organization emphasizes that these interventions are very often carried out based on outdated beliefs, not supported by medical literature. And then this section emphasizes that these medically unnecessary interventions have to be distinguished in law and policy from urgent and necessary medical treatments. So intersex children and babies, like any other babies or children, may sometimes require medical treatment to preserve their life and health. And an example is, for example, hormone therapy to prevent fetal salt loss in some intersex babies. Then the next section hones in on discrimination, and they're really highlighting that at the moment, there's only 10% of states worldwide that prohibit discrimination based on sex characteristics or an analogous ground, and emphasizes, widespread discrimination in a range of areas. For example, in health, widespread violations of privacy, lack of services that address the specific health needs of intersex persons, intersex persons being used for teaching purposes without consent, and the absence or inadequate nature of standards of care around the health of intersex persons. In education, widespread bullying, insults, violence, blackmail, and interruptions to education due to the impacts of unnecessary medical interventions. There's also reference to statistics around discrimination in the context of employment, but also housing. And there we quote the EU Fundamental Rights Agency survey. There is also discrimination in the context of sport, with a number of regulations on eligibility in women's sport at elite level, but we see increasingly also impacts at other levels of sport. And then also obstacles to access to justice, especially around lack of access to medical records or statutes of limitations that are barriers to intersex persons obtaining justice and remedy. And then the final section in this chapter on human rights violations really hones in on root causes. And there's quite a number. And these, I think, are key to really understanding and being able to address human rights violations against intersex persons. So one major one highlighted in the report is the fact that parents only receive partial, incomplete, or misleading information around medical interventions, including receiving information on negative or long-term consequences of these medically unnecessary interventions, also the human rights and ethical considerations, and being aware that there are alternatives to any interventions that may be proposed. Major root causes, of course, harmful stereotypes around appearance and function of bodies, and especially male and female bodies. Pathologization, so the consideration of intersex persons and intersex bodies as disordered in some way. And major other root causes are lack of awareness and understanding around who intersex people are and the diversity of intersex persons. And other root causes that were highlighted are also that in all regions, there are harmful beliefs, a stigma and taboos around intersex persons, and this can vary and look quite different in different regions. But in all regions, it was also part of the underlying root causes for some of the violations faced by intersex persons. Then the report goes on to examining promising practices and of course based on the inputs we receive from states, from society, from national human rights institutions. So some of the promising practices highlighted in the report include the prevention of violence, and so some of the mechanisms for which states took action there was in the integrating sex characteristics in legislation on incitement to violence or hate crimes. And we have 7 member states that have taken steps there. The prohibition of medically unnecessary interventions without consent through legislation. So we have 6 member states that have taken action there. I think it's important to highlight that it's not just about the prohibition, it's also around specific legislative clauses that either drill down and specify requirements around ensuring that if interventions take place, they have the full and informed consent of the person, the intersex person concerned. Critically, having independent oversight to assess requests and to be able to distinguish what is medically unnecessary and non-urgent from what is medically necessary and urgent. Access to counseling and guidance for both parents and intersex persons themselves, the retention of records around any interventions carried out, and the alignment of relevant legislation, but also any medical protocols, standards of care, with human rights standards, including, in the case of children, the Convention on the Rights of the Child. We have 16 member states that have taken legislative steps to prohibit discrimination based on sex characteristics or analogous grounds. We also have good examples of national human rights institutions or equality bodies or in other national mechanisms taking steps on monitoring the situation of human rights, the human rights situation of intersex persons, reporting on the situation, and also advocating for protection and remedy. We have on the judicial side a number of court cases in different regions where intersex persons were able to access some form of remedy for violations they faced, including medically unnecessary interventions. In some cases, issuing protection measures to prevent violations, and in some cases, directing states to take legislative action to protect intersex persons. We also have public apologies for past harms carried out and compensation for harms as well, for example, forced or coerced or involuntary sterilization. Those are some good practices around data collection, a number of surveys carried out by both state bodies, sometimes subnational bodies, reports, but also the development of data collection standards that allow the capture of information around intersex persons in a way that aligns with international human rights standards based on confidentiality, but also disaggregated data, and that avoids amalgamation or confusion with other topics and issues. And then we have also, and really importantly, promising practices of collaboration between states and civil society, intersex human rights defenders, different bodies set up that include intersex persons and organizations in the development of legislation, in the monitoring and implementation of legislation, and in protection and awareness raising measures. And then there's a number of other initiatives. In Kenya, we have the Children's Act. We have non-legislative approaches in some states, such as decrees. And we also have actions at subnational level, sometimes provinces or cities that have taken measures as well. The conclusions, the recommendations. I think, on the one hand, the report highlights the significant advances that have taken place in the past decades. There were no measures at all, 20 years ago. There was no framework at all. There was very little awareness. And thanks to the work of intersex human rights defenders, there have been major advances. Human Rights Council resolution, in the Council of Europe at national level in Europe, there have been so many advances, so significant, and that is all thanks to the work of intersex civil society organizations and human rights defenders. But also the report highlights the reality that more than 90% of member states have not taken action to address human rights violations against intersex persons, and that there are large gaps. And even where we have seen, legislation, protective legislation take place, there's still a number of gaps around monitoring and implementation. So given all that, some of the key recommendations of the report highlight some of the issues already highlighted in the previous sections, really around combating violence, hate crimes, and discrimination, and including sex characteristics in relevant legislation in all of these areas as protected grounds of discrimination and as aggravating grounds in relation to hate crimes, for example. Where violations occur, of course, states have an obligation to investigate, ensure accountability, and also ensure remedy, and to combat impunity, right? So I think some of the key issues, especially for all the violations that have taken place in the past, people are still living very much with the consequences of these violations. And so addressing impunity also through reviewing statutes of limitation and other barriers and obstacles to remedy. There's, of course, a strong and large section of the recommendations around the prohibition of medically unnecessary interventions without consent. And I think it's really important to go into the detail of that. You can look at the report and the specific recommendations there. But around the safeguards, a generic or vague prohibition is often not effective. And what we see from the promising practices is the importance of having safeguards, including independent oversight of decision-making. Around health, some of the recommendations are around access to adequate services that actually address the health needs of intersex persons, the review of medical protocols and standards of care in line with human rights standards on health, and also access to counseling and to medical records. There are recommendations around birth registration and accessibility of change of markers on documents, and the emphasis is on simple administrative procedures, and especially, and this is what we've seen in some states, having no requirements and no encouragement of medical interventions, either at the moment of registration of birth or at the moment of persons seeking to, if persons seek change in markers on documents. Recommendations also around disaggregated data collection. Of course, we have some good examples and promising practices in the report, and it's been done at regional level, but there's still a long way to go in terms of data collection, especially at national level. The importance of awareness raising campaigns, and of course we're coming up to Intersex Awareness Day very soon, and Intersex Day of Visibility, and these are really important moments, but really the need to ensure constant awareness raising, because there's still such an information gap, because there's still such widespread stigma and stereotypes, and the need to consult and of course support intersex society and human rights defenders. Finally, there's some recommendations to national human rights institutions, health professional bodies and associations, to business and to sporting bodies as well, respectively. And maybe I'll stop there, and looking forward to the Q&A at the end. And yeah, here are some contacts and links that I'm sure we can also share with all the participants. Thank you.
Thank you very much, Michael, for the very rich overview. I will now give the floor to our second speaker, Miltos Pavlou from FRA.
Hi, Madalena. Hi, everybody. As you well know, about a month ago, am I sharing? Yes, I am.
Yes, we can see the presentation.
We published a report with some insights of the third LGBTIQ survey we conducted in 2023, and we salute this report by the High Commissioner, and which basically converges to more or less the same and similar considerations and results that we did with this report. As you all know, I hope, yeah, I can do that. You all know the main messages of the survey that we published now a year ago, that we are living in a critical moment at a crossroads, where we found some signs of slow, gradual progress. We found also increasing and persisting and very alarming results about violence, harassment, and discrimination, especially for some groups, and that this is the moment that we need to strengthen basically our actions, the steps ahead. With the Being Intersex in the EU report that we published in September, we try to provide more in-depth insights on some particular warning results about intersex persons. We found that they have been facing extremely increasing rates of violence, harassment, and discrimination. And we consider, and we put that in the report, that they are emblematic as a group, a small group, but emblematic of the entire LGBTIQ community within their intersectionality. Also because, in a way, they do represent the claim for equality, but also the history of the fight for equality of the wider LGBTIQ community. If we have identified that there is a decrease, even slow, gradual, of discrimination against some groups of the LGBTIQ community in the member states of the European Union, especially regarding social acceptance of same-sex couples, this does not extend to intersex persons. Intersex persons experience what the community has been experiencing for decades, for a long time. And within a more general approach and other indicators of the survey, we came to the conclusion that this group is excluded from society in a particular way, in a cumulative way, and marginalized, which means also facing barriers and not being able to exercise basic individual, fundamental, and social rights. We found too high rates. This is a group that experiences the highest rates of homelessness in society at all, also among other minority groups in society, and extreme mental health problems. Trying to make sense of the data, because we collect a lot of data in our survey, we found also that they are particularly targeted by disinformation campaigns. It is interesting that among all groups, they experience disinformation online, of course, about LGBTIQ propaganda, traditional values, all these usual campaigns against the community, but intersex in particular experience disinformation and campaigns calling for violence against them, which is another divergence from the average we found for all other groups in the survey. So we found the highest violent victimization. It's a group that has marked the largest increase of violence, and it was marked also in the report mentioned before by Michael, 32% in the 5 years before the survey. It is the only group among all respondents groups in the survey that did not report decrease of discrimination experiences. All other groups have reported minor or more decrease of discrimination in the country, because the European Union is a union that has in place all the legal, let's say, arsenal required to fight discrimination. How it is implemented is another issue. Reporting remains too low. And we've confirmed the result of 2019 that the majority of intersex respondents or the panels did not provide fully informed consent before the first effort to modify medically their sex characteristics. And last but not least, there's an enormously large proportion of respondents that contemplated suicide in the year before the survey, more than half. And while all LGBTIQ respondents still they report too high for 40% more or less. And within the intersex group, trans women intersex and trans men intersex report the highest percentages, above 60%. And FRA, in its recommendations in this report, called the EU and member states to strengthen their efforts or to ensure the respect of the fundamental rights and protect from discrimination, violence, and harassment, as well as from medical interventions, unnecessary medical interventions to modify sex characteristics without a fully informed and free consent. And I think all that within the frame and the angle of the social inclusion, because we have a group that is particularly excluded from society. This is a slide with a list of the headings of the recommendations that you can find online. We try to identify the issues where it will be most effective to deploy efforts, legal policy measures by member states in order to improve the situation. And on the right side, you see the actual chart that compares between the different groups based on the basis of sexual orientation or gender identity and sex characteristics about the experiences of hate-motivated violence in the last 5 years. And this is a slide which relates to the sample of the intersex persons respondents in the survey. As you can see, there's a big intersectionality dimension here. I put here, of course, most of you are mostly acquainted of SOGIESC identities, but I have to say we found it really hard to explain even to experts or to everyday persons what intersectionality is, how the intersex group comprehends all these diverse identities that we need to understand in order to be able to respect and protect the rights of the people. As you all know, I don't know if the audience would be very much acquainted today. I think you all are. Well, this is a very large survey of 100,000 respondents. It's a big effort to survey hard-to-reach groups. This is, therefore, is the largest sample of intersex respondents ever produced through a survey. So 1,920 intersex respondents, people that identified with variations of sex characteristics that were then named intersex within the framework of the report and the questions they had to answer, because there's always a different way to define or to identify members of a group. It's necessary. This is a policy-oriented, a policy-based survey, which needs to build around identifications and how the people are grouped within meaningful categories that are addressed by law and policy. These are the themes of the survey that you are all acquainted with. And this is a background slide I always keep in my presentations because in this report, the last report we published, we emphasize even more on the element that we discovered, let's say, going through the data and through other European Commission research, that intersex people are the target of this information, maybe because the general population exactly has little knowledge or understanding of the intersectionality and the specific needs and rights of intersex persons. And this is something that is weaponized by those who conduct manipulation, interference campaigns, disinforming about the group, and therefore fueling hatred, misunderstanding, misinformation, and exclusion of groups like intersex people, in this case, using what we call identity-based disinformation, and try to flag in this way to the policymakers and to the member states why it is so important, not just for the sake of protecting people's rights, because this is a binding obligation of duty bearers, but it also relates to the entire society, and it flags the urgency of the day of the situation in order to protect the rights of the people and protect our society as a whole. This is why we try to put forward and convey this message. And here you can see the LGBTIQ Survey Data Explorer, which is a very useful tool. It's very insightful, and I recommend you to dig into the data and try to use different filters you see on this slide. to identify and find eye-opener results like we did, especially when drafting this second report, which is based entirely on the use of Data Explorer. Thank you, and open for questions and discussions. Thank you.
Thank you very much, Miltos. Being conscious of time, I'll give the floor right away to our first speaker, Dan Christian.
Thank you, Madalena. So first of all, I really want to congratulate the Office of the High Commissioner for Human Rights again to this excellent report and for comprehensively addressing the human rights issues intersex people face around the globe, including in Europe, and for giving very clear and concrete recommendations to member states about how to ensure the protection of intersex persons' human rights across all areas of life. Intersex people in Europe, as you, Miltos, just described, still face violations of their human rights to health, bodily autonomy and integrity, freedom from violence and discrimination, including in medical settings, and of the rights of the child. Intersex infants are still subjected to intersex genital mutilation. Hate speech and hate-motivated violence against intersex people are on the rise. Discrimination at school, in the workplace, in sports, and other areas of life persist. Research and reports show that prejudice and negative attitudes against intersex people are still widespread across the EU, and yet Europeans are also increasingly more aware of the discrimination affecting the lives of intersex people. The findings of the 2023 Special Eurobarometer on discrimination in the EU showed that intersex people, together with trans people, are still among the most affected by discriminatory attitudes, even in very LGBT-friendly countries. According to the survey, 47% of respondents found that discrimination on the basis of sex characteristics surrounding intersex is widespread in the country, reflecting an increase of 8% compared to the 2019 Special Eurobarometer. Intersex people with intersectional experiences and identities are specifically vulnerable, according to the 2019 and the 2024 FRA LGBTIQ survey findings. An in-depth analysis of the 2019 findings that OII Europe and ILGA Europe conducted together showed that while, for example, almost 30% of intersex respondents reported having had their specific health needs ignored or experiencing inappropriate curiosity or comments when seeking healthcare, intersex people with intersectional identities were even more affected. For example, 40% of intersex respondents from an ethnic minority or with a migrant background avoid healthcare services completely, and almost 50% of intersex respondents with disabilities and more than 53% from an ethnic minority migrant background experienced homelessness. Still, I'm glad to be able to say that we have seen growth of awareness among policymakers and the general public and a clear increase of legal protection in the past 10 years. Since 2015, 6 states have banned the harmful practice of intersex genital mutilation. And considering that just 15 years ago, the existence of intersex people and the knowledge of the human rights violations we face was so scarce to non-existent, this is an incredible success. It is also a consequence of intersex activists and intersex-led organizations using existing mechanisms, like the UN treaty bodies, shadow reports, for example, to urge member states to finally take notice of the human rights violations they face. It's also a consequence of member states listening and finding the political will to initiate change. However, those laws protect intersex people to different extent. While in 4 countries out of the 6, the legal prohibition of IGM in place provides a rather satisfying protection overall, other areas are strikingly missing from IGM bans, such as the provision of information and support, measures on access to health, such as educating healthcare professionals about variations of sex characteristics, and effective monitoring mechanisms, which are absent from all 6 laws. Implementation reports from OII Europe member organizations show that even in countries that have established protection against IGM, implementation can be lacking. This includes, for example, courts not taking up their role as safeguarding entities as laid down in the law. Another significant progress is the ground of sex characteristics that has been established in Europe as the adequate ground to protect intersex people. As of 2025, 14 Council of Europe member states, including 9 EU member states, have included sex characteristics as a protected ground in at least one area of life. And in addition, 10 Council of Europe member states and 8 EU member states respectively have legislation in place on hate crime and on hate speech covering the ground of sex characteristics. Most recently, the ground was mentioned for the first time in an EU directive, the Directive on Standards for Equality Bodies. Legal protection, as we all know, does not automatically, however, equal comprehensive implementation. And as violence and hate speech against intersex people are growing from bad to worse at an alarming rate, this is an increasing problem. 74% of intersex respondents to the FRA survey said that they experienced hate-motivated harassment in daily life in the 12 months before the survey, compared with 42% in 2019. And 34% said that they experienced one or more physical or sexual attacks in the 5 years before the survey, including 72 of them who experienced multiple hate-motivated physical or sexual attacks. 76% of the intersex respondents suffered bullying, ridicule, teasing, insults, or threats because having a variation of sex characteristics. So while we continuously have been seeing progress on one hand, it is also very clear that on the other hand, huge gaps still remain and much more good practice is needed to address them. Experience shows that an increase of good practice is linked to an increase of knowledge, but also to the possibility of exchange with others. And this is why in 2019 we decided to publish an annual good practice map that would allow for broader dissemination of existing good practice. This map identifies identifies good practice from the previous year across Europe for different areas of life. And as such, it gives a broad overview of the situation in Europe as a whole and allows us to track trends related to which areas benefit from more or less progress over the years. And the areas differ from year to year, so it depends on the existing good practice that is communicated to us by our member organizations. In the one we published in 2025 about the year 2024, those areas include legislation, political recognition, human rights bodies, asylum, research, education, or hate crime legislation. The In the Making section speaks specifically about initiatives and laws to protect against IGM. If you're interested to learn more about the 2024 good practice, there is a QR code that is not completely visible, apologies for that. That I would invite you to scan. You can also go to our website, oieurope.org. And on this website, you can also see the many smaller and bigger steps that have been taken in Europe towards intersex protection in the past few years that I'm not going to mention due to time constraints. However, I want to mention one, which is the one that happened last week. It's one of the biggest ones that took place on the 7th of October with the adoption of the Council of Europe Committee of Ministers recommendation on equal rights for intersex persons. The recommendation was adopted unanimously by the Committee of Ministers of the Council of Europe, representing all 46 Council of Europe member states. It is the first comprehensive international human rights instrument dedicated to advancing intersex rights. The recommendation covers a comprehensive range of topics for the advancement and protection of intersex rights, from the prohibition of non-consensual interventions and treatments, access to justice, redress and monitoring mechanisms, tackling hate crime and hate speech, prohibiting discrimination in the areas of education, employment and sport. It also covers access to health and social care, right to family and private life, the right to seek asylum and data collection. While not legally binding, it is an invaluable tool to guide member states to advance equality and the rights of intersex persons at national level, as it provides thorough guidance to the member states on closing persisting gaps. For example, on protection from IGM and from establishing sex characteristics as a necessary protected ground for discrimination, among many others. The recommendation will be officially launched on the 27th of October, and Council of Europe has joined forces with OII Europe for a big campaign, Europe Goes Purple, from the 26th of October to the 8th of November. And you can find more information about this event and how to join it on the website www.europegoespurple.org. Such a recommendation, as you are well aware, cannot be created in a vacuum. If you look at the explanatory memorandum to the recommendation, you can see how much already existing human rights documents and instruments and standards and initiatives have contributed to these recommendations, and that also includes what a substantial role UN mechanisms and initiatives have played in paving the way for these recommendations to come into existence. The UN report and the 2024 UN resolution on promotion and protection of all human rights of intersex people give a statement to the progress made by states and international organizations driven by intersex human rights defenders and civil society actors towards the protection, promotion and fulfillment of the human rights of intersex persons. But they're also a call not to stop here. UN member states, Council of Europe member states need to follow through and ensure that recommendations turn into lived realities for intersex people in Europe and everywhere across the globe. Thank you.
Thank you very much, Dan, and all our speakers for the very insightful presentation. It was a lot of content, but we hope that you're able to follow all of it. We still have some time now for our Q&A. I see that for now we don't have any question, but we'll give you some time if you're typing right now or preparing to ask a question to any of our speakers. Otherwise, maybe I will kickstart the Q&A. I would have a question for Michael, actually, about, you presented the report and very detailed content of what's in the report, but what do you think its impact will be in the current context?
Thanks so much, Madalena. I mean, we hope states will implement the recommendations. I think, look, one of the key impacts of the key intended impacts of the report is really to raise awareness. This was the first time we had a report discussed at the Human Rights Council. First time we had a panel discussion with all members of the council there. And I think, we still need more of that awareness raising. In initial discussions on the resolution, there was a lot of, maybe misunderstandings or confusion around who intersex people are, or what issues they face. And there's still so much of that work that needs to happen, including among states. Then to highlight the seriousness of the concerns and the unanimity, the consensus among human rights mechanisms in all regions, but also to show that change is possible, right? I mean, people first are not necessarily aware of who intersex people are, or the seriousness of the human rights violations they face, or that actually that solutions exist and are being developed and implemented. So certainly more awareness and hopefully also more dialogue between regions. I mean, here we're talking about the Europe region, but I think there's also some interesting exchange of lessons learned that can happen. We've also seen developments in different countries in Africa and at regional level and in Latin America. So I think it would also be great to see more of that exchange between regions, but certainly also more monitoring and taking of adoption of legislation and policies. Thanks.
Thank you. Thanks very much. And we just had now another milestone with the adoption of the Committee of Ministers recommendation in Europe. So maybe I will lead with that then, like the impact of this now new recommendation next to the OHCHR report and the interplay between different regions of the world. Can you maybe tell us a bit more about this?
Yeah, so I mean, this is a watershed moment. These recommendations, none of us could have believed 10 years ago that we would ever see that, and certainly not within 10 years' time. So this is really a testament to an incredible development, and as such, it is also really a sign for the intersex community, for intersex people, that they are heard, they are visible, and that the human rights violations that they face are being taken seriously. So last week was really incredible, and it still is an incredible feeling. And at the same time, we know that now action must be taken in the member states. But also from the whole process, I can really say that part of this process has been an increase of understanding of policymakers and politicians. So it's not only about recommendation as they are now, but it's really about the whole process that has increased awareness over the 3.5 years that this process was going on. And this is also a benefit of the recommendations. They're also very comprehensive. They take into account potential limitations in speeds of different member states, which also makes them more accessible. So we see that as a document where we expect member states to take step by step, as fast as possible, but also with thoroughness, the actions that they need to implement the different details of the report. The recommendations, sorry about it.
Thank you. Thank you, Dan. If anyone wants to jump in or react to anything that Michael or Dan said, please feel free to do so or to ask your question. Otherwise, maybe I will ask a question to Miltas, who gave us a very detailed overview of the latest report from FRA, an analysis of the intersex-specific information from the latest LGBTIQ survey. We were talking about awareness raising and how people are starting to understand more what we mean by intersex. This is the second, this is now the third wave of the FRA survey. Do you have any indication of the impact that this data has had now that this data is being used by FRA, by the EU, by several civil society organizations? Do you have any indication of the impact of this data?
Yes, we do. At the European Union level, you will know that the LGBTIQ strategy of the European Commission is very much based on the insights provided by the survey, because, as I said before, the results are eye-opener, how you can identify things that otherwise you're not able to see. And this is the benefit of the FRA surveys, because we actually go on the ground and ask about real-life experiences, not about how people perceive others or how they, but talking about what really happens in people's lives. And this is very important in measurable terms. The LGBTIQ Survey Explorer of this third wave, but also the second wave and the first wave, is the most popular explorer, with more than 100,000 views for the three surveys in 1 year, in the first year, between May 2014 and 2025. This is by far the biggest audience we have. Plus, we know that the methodology that we have now developed is discussed, and we support other countries in the European Union and out of it, beyond the European Union, to adopt a best way, but still developing always. But for the time being, I think it's a gold standard on how to survey people with respect and understanding of the intersectionality and the multiple layers of identities, in the effort that comprehension will also lead at some point to better policies and protecting actual people's rights.
Thank you very much, Milta. So these are very impressive numbers in terms of the Data Explorer and the visibility that it brings. Being conscious of time, maybe one last question, going back to global level and UN level. For you, Michael, do you foresee, or can you already tell us of any next steps following the publication of this report now when it comes to intersex rights globally and within the UN framework?
No, thanks so much, Madalena. Well, I mean, we're doing some work to try to disseminate the report and its findings. We have so a campaign. You can see some of the visuals during my presentation for Intersex Awareness Day and the visibility coming up, really highlighting the voices of intersex human rights defenders around the world who have been working tirelessly for these changes and the importance of the recommendations and findings. I think Dan mentioned, there's a lot of UN mechanisms, so treaty bodies are reviewing states, every couple of years, and intersex defenders are providing inputs on how the situation is developing, both the positive steps, but also the increasing levels of violence and discrimination. And so those are coming to recommendations. And of course, at the Council, I think after this initial resolution and report, perhaps we can expect further action at the Council in the coming years. And of course, that's up to member states and their partners, including civil society. But I think, I would expect some follow-up also in the coming years there. Yeah.
Thanks very much, Michael. I see that we have a question in the Q&A section for Dan. So I'll just read the question. We saw reactions on the scope presented in the new EU strategy as concerned intersex rights. Are you hopeful that the implementation will go beyond the explicit paths outlined in the document?
Well, yes, we hope so, and we expect this to happen. The strategy is very different from the first one, in that it's less ambitious when it comes to very concrete measures, but then again, it's also very broad and has a very strong focus on mainstream. And for us, this is a good start. Now it will be really about like how much this mainstream can take place. This said, though, there's like really a lot of initiatives, broader initiatives that are mentioned in the strategy that we hope we can make use of in supporting the European Commission to enhance intersex people's rights. So this, for example, would be exploring the ways to strengthen the criminal law framework for combating hate speech, or tackle the issue of online hate, preparing recommendations on equality data, then, for example, the Equal Treatment Directive. So all of these are topics that are very, very important for intersex people, and we will definitely work towards making sure that intersex people are and intersex people's needs are included in the full scope. So it will be really about seeing like what concrete initiatives and measures and actions the European Commission plans to implement the broad structure of the strategy.
Thank you very much, Dan, and thank you to Milan for bringing the new EU LGBTIQ equality strategy in the conversation. It was also only adopted a few days ago. This has been very rich news when it comes to very rich period of time when it comes to LGBTIQ rights. Are there any more questions from the audience as we are running in our last few minutes of this webinar?
Madalena, if I can chip in, since nobody, 2 points. One I didn't mention before. You hear me bragging about how great survey we have and tools. We have to say how important it is as a principle, but also in practical terms, how it has been implemented, the cooperation, the consultation of the community of people who actually experience and know. Without the support from Dan, LGBTI networks and colleagues, experts you all know, this survey would not have been so good. So that I want to thank them, but it's not just about thanking them. I want to stress how important it is when you develop policies to involve by design in all stages the actual rights holders, which relates to what Dan said, and I hear it's not my place here to judge about the strategy, but it is important to stress how significant will be the contribution in implementing actually a framework that is there. Allow me, through my decades experience, sometimes soft tools like action plans and strategies are more efficient from hard tools like legal instruments, and this might be the case now, especially since the Commission, as far as I read the strategy, calls, and we know from also other areas of policies in the Agency for the Fundamental Rights, that it is now the time of the Member States to step up and adopt and implement properly action plans. We are there to support them, you are there to support them, and you're not just auxiliary. I want to mention that how its primary force is the LGBTIQ community in this case. Thank you.
Thank you very much, Miltos. Indeed, we will be working on monitoring the implementation of the strategy. Did anyone want to react to this comment? Okay, well, I think if we don't have any more questions, we'll end this webinar by thanking all of you for joining us today to mark the launch of the UN report. And yes, please follow what's happening around the 2 weeks of Intersex Awareness Day and the Intersex Awareness Weeks and the Europe Goes Purple campaign. Very nice visuals for you. So yes, please check all of this out, and thank you very much, and have a nice rest of your day.
Thank you, Madalena. Thank you all.
Thank you so much.
Thank you.